The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
Hello viewers, good evening. Welcome you all to today's episode of Kimshealth Dr. Live. Myself Kripa Raji. As we all know that the holy month of Ramadan has started. On behalf of Kimshealth Dr. Live, I wish you all a happy Ramadan. Today we have taken the topic lifestyle disease and intervention. To talk more about this topic, we are having an efficient doctor with us. It's my pleasure to welcome Dr. Hajira Begum to the show. She is working in Kimshealth Medical Center, Mohran, as an internal medicine specialist. She is having 20 years of experience in this field. Hi doctor, welcome to the show.
Hi Kripa, thank you for the introduction and thank you to all the viewers of BMC. I'm Dr. Hajira, internal medicine specialist in Kimshealth Mohran. And as she has already introduced, today we are going to talk about lifestyle diseases and interventions. And first of all, Ramadan Kareem to all the viewers. And since we are in the holy month, we really need to know how to adjust our lifestyle and our diet.
Okay, so can we have a discussion about the topic, doctor?
Yes, definitely.
As I told you earlier, today's topic is lifestyle disease and intervention. Can you please tell us what is lifestyle disease and what are the causes of it?
Yes. As the term indicates, lifestyle diseases is because of our unhealthy lifestyle. The diet, it's so unhealthy. At the moment, we're so dependent on junk food, processed food. We are not taking a balanced diet. So the unhealthy diet, that is one of it. And now, since the pandemic started, the work is at home, schools online, colleges online, sedentary lifestyle. So all this contributes to an increase in the lifestyle diseases and also the habits like smoking, alcohol and substance abuse. So we are seeing an increase in the cases of diseases and we term this as a lifestyle because it's because of our unhealthy lifestyle. And lifestyle diseases, if we have to say, The first and foremost that we have is obesity. We are seeing an increase in the number of cases of overweight and obese cases. And apart from that, lifestyle diseases also includes diabetes mellitus, which means high blood sugar, hypertension, hyperlipidemia, and these are causing an increase in the cases of heart attacks and stroke. Also, because of smoking and alcohol, we have an increase in the cases of chronic obstructive lung diseases and cancers. So all this is a complex spectrum, which means, we put it as a term, lifestyle diseases.
Okay. Doctor, while you are telling about the obesity, we have seen a number of cases, increase in the number of cases due to obesity. Can you please tell me what is obesity and how adverse it will affect our body?
Yes. Obesity, as we all know, it is an abnormal accumulation of fat in our body. So there is, like to tell if a person is obese, we have certain formulas. The most simple is, suppose your height is 160. You need to subtract 100 from it and you get 60. That is the upper limit of the normal that you are according to your height. But if we have to calculate, we have another formula that's called BMI. BMI stands for body mass index, so that you can calculate with your height and your weight. So kilogram per square meter, and the normal limit for BMI is 18.5 to 24.5. If it is more than 25, you are in the category of overweight, and if it's more than 30, it is obesity. Why are we very concerned about obesity nowadays? It's because this is leading to, as we already mentioned, lifestyle diseases. It is the most biggest risk factor for developing type 2 diabetes mellitus, hypertension, high cholesterol levels, heart attacks and strokes. So that is why our main target now is to tackle this obesity, because this is the first step to developing a lot of disease and a lot of complications in the future.
Okay. Doctor, even we have seen sometimes there is a darkening in the skins of necks or armpit. What could be the reason for it?
Yes. So this is a condition where the person develops skin darkening. If you see an obese person, or if you find a person who has skin darkening, or we call it hyperpigmentation, and the medical term is acanthosis nigricans. So this, you can find the skin is dark in the neck and in the armpits, and there are many conditions which can cause this. But since we're talking about obesity, it is one of the cause, because what actually happens, there is insulin resistance. Your body is able to produce insulin, but it is not metabolizing the sugar in the body. And this is a sign that you really need to look at the lifestyle that you're leading, and you need to consult a doctor to see if you have any other conditions and get evaluated for it.
Coming to diabetics, doctor, that is one of the most common lifestyle disease. Most of the people will be saying, I'll not be taking the sugar, but how I am diabetic? What is the reason for that?
Yes, that's a good question, because most of my patients come with this question. They say, Doctor, I hardly take any sugar in my coffee. There's no sugar in my tea. But how do I get this? So let's talk about diabetes, because it's one of the most common condition. There's not one household where we don't see a person with diabetes. So when we talk about diabetes mellitus, it is basically high blood sugar. And high blood sugar can be the most important thing. It could be genetic. It could be familial. So you have one part where it's because of the genes. But the other part nowadays, we see an increase in the cases. That's because of the lifestyle, as we told you. And it not necessarily means you need to cut down on sugars. Sugars is overall carbohydrates. How much are you talking about processed food, the junk food, the carbs, the rice intake? All this put together is also an important cause for developing diabetes. Nowadays we see cases where they are developing diabetes at an early age. Earlier back in our days, there was hardly very few cases, and that's because our diet was very healthy. and we used to be very active. We never used to be stuck at home. And even transportation here, it's quite easy. You go to the malls and you hardly walk, and everywhere you have the car. Here, life is so easy here that we hardly do any kind of exercise. And moreover, because of the pandemic, we see everyone is stuck at home. We see there's an increase in the number of cases where children are becoming obese. They're not having absolute zero exercise. School from home, colleges from home, everything online, and sedentary lifestyle, no activity. You ask any kid to go out and play, they're stuck with these video games, PUBG, absolute zero exercise. So we see there's been increase in the cases. So diabetes is basically high blood sugar because of genes and the environmental and the lifestyle causes.
As you told now, age is not a matter for diabetic. Earlier, earlier cases means when we get aged only we will be having diabetic. Now even a small kid is having diabetic. So can you please tell the symptoms of diabetic, how we can identify?
Yes. Actually, children also developing diabetes, because diabetes is not just, there are many kinds, many types if you classify it. We have type 1, which is insulin dependent, type 2, which is, it is at a later age. So basically, this now we are having an increase in the case because, as I told you, first is genetic. So when we know, how do we know? That's your question, right? So when we talk about diabetes, the symptoms, the first and foremost, the person will have some kind of symptoms, especially when we say there are 3 P's. We say polyphagia, and the patient is hungry. So you feel hungry very often, you eat a lot, but despite all this, there will be an increase in weight loss. So that's one P. Another is polyuria, because there's an increase in the glucose in the body, it pulls in water, and so they go to the bathroom, they urinate very often. The third P is polydipsia, because there is increased sugars, there is increased water intake, and they drink quite often, so they go to the bathroom quite often. And apart from that, you will have recurrent urinary tract infections, you will have recurrent genital infections like thrush, candida in the vagina, and the patient will also complain of dizziness, feeling very tired, and blurring of vision. So there's quite a lot of symptoms which should prompt you to see a doctor to get evaluated.
Coming to the medication, common people have a thought that if you are taking the medication for a long time, we will be dependent on the medication. Also, they have thought that if you are taking the medication for a long time, it will affect some of our organs. Can you please give a clarification about this?
Again, this is a very common question. I have many patients who come with this question, and in fact, there are patients who are non-compliant. It is in their mind, or it is because of pressure from the family and friends. They're really confused. They're often told that once you start your medications, you cannot stop it, and it's lifelong, and also the medications have side effects. This is a common question. So what I want to say is, the most important thing is you have to see a doctor, and the doctor is going to examine your blood tests, right? So when the tests are done, there are certain tests that we have. So the first test that will be done when you come, it will be a fasting blood sugar. So if it is on 2 to 3 occasions when it is checked, it is 126 milligrams or more, or on a random blood sample it is more than 200 milligrams, and if the doctor does your HbA1c, it's more than 6.5%, then you fit into the category of diabetes. So if it is in the borderline, that's a condition called prediabetes, then it can be managed by diet and lifestyle alone. But if you're in the diabetic range, then it's definitely very important that medications have to be started. Despite talking to the patient and informing them about it, I see that most of the patients are non-compliant. They are averse to the idea of taking medications for lifelong. But the most important point that I have to stress is, first and foremost, you have to accept that you have the condition, and then you have to look into ways to tackle it. So when medications are started, please stick to it, because otherwise diabetes can have multiple complications. It can affect many organs. We classify the complications into macrovascular and microvascular. Macro is the big vessels, microvascular is smaller vessels. So macrovascular, when we say the brain and the heart, so diabetes is not just going to affect one organ. It's basically the hormone called insulin produced by the organ called pancreas, but it can affect any organ. So it can affect the brain. So there's an increase in cases of stroke and paralysis, the heart, so heart attack and cardiac failure. So talking about microvascular complications, you find there's an increase in the number of cases of kidney problems. It can affect the eyes, so the vision is affected, the retina is affected, and most of the patients come with burning sensation in the legs. So that's because the nerves are involved. And apart from that, even the oral, like, there'll be increase in the number of cases of dental infections and gum infections. So it's not that, why is this happening? It's because you have a high blood sugar, and that blood sugar has to be metabolized, it has to be reduced. So your body is not able to produce the hormone called insulin. So you need to take medications, because if you don't take it, then the blood sugar levels are so high, it can damage any organ in the body.
Doctor, can you please explain us what all tests we need to do to detect diabetics? You already mentioned about fasting blood sugar.
Yes.
I had heard about HbA1c, like that. Can you please give more clarification about that?
Yes. So once you have symptoms or you have a family history of diabetes, you should have a screening. So these are the screening tests. So as I already explained, we have fasting blood sugar, which is a fasting sample. You go with 8 to 12 hours of fasting. You can take water, but you shouldn't take even tea, coffee, or anything, any dates, no. So you go get your fasting sugars done. So if it is more than 126, definitely then it's diabetic. The test that you're talking about is called HbA1c glycosylated hemoglobin. Now this is a test which tells the level of blood sugar in our body over the past 3 months. How good is the control? Because sometimes I find my patients come and tell me, doctor, I had a heavy meal yesterday. I had burgers, I had pizzas, so definitely my fasting sugar is up. So the other test which is most important is this HbA1c, and this tells us if the patient is in borderline or has crossed it and is in the diabetic range. There's another test also called OGTT, that's the oral glucose tolerance test. So as I told you before, it's not just with one test, we label a person as diabetic, but we take the fasting sugar, the HbA1c. If these are inconclusive, we go ahead with the OGTT. So when this shows that it is beyond the normal range, then we need to consider, and we need to inform the patient, and the patient and doctor, they should have a common consensus and then decide to take medications if required.
we are coming to the results, usually we'll be saying that the fasting, comparing to after food and fasting, usually after food will be higher than fasting. But in some cases, the fasting will be higher than after food. Why is it so? After food will be normal, but fasting will be higher. Why is it so?
This is because of fasting sugar, it all depends on what you had in the previous night. If you had a very heavy meal, and especially in diabetes, it's a sign that it's an early sign of diabetes. It's the beginning stage. So that time, the postprandial and the random are absolutely normal. So I've had patients who come with this condition where the fasting sugar is elevated, but the random sample, whenever they check, it's very much normal. So it's very difficult to convince them that there is a problem. This is the beginning of diabetes, and you really need to adjust your lifestyle. You really need to adjust your diet. See what you're eating previously in the previous night, and are you doing any kind of exercise. Especially in the night, we have release of hormones. Our body releases chemicals like steroids, and these play an important part for increasing the fasting sugar in the morning. So fasting sugar, then you have to have a complete evaluation and change your lifestyle. And if there are symptoms, usually if the fasting sugar is very high and the HbA1c is almost high, then we would prefer to start them on medications along with lifestyle changes.
Ma'am, now coming to gestational diabetic. Why is it crucial to control diabetic during pregnancy?
Pregnancy is not just one life, it's two lives. It's the mother and the baby. It's very important when diabetes is detected in pregnancy, you should have a follow-up with your doctor, and you should strict control of sugars is very important. Because apart from the mother, the baby is getting an excess sugars. So what that does, the maternal blood carries this to the baby, and the baby's pancreas and the body understands that this high sugar, it starts throwing out insulin. So the baby is having hyperinsulinemia, and so we find that there are complications during pregnancy, during delivery, the sugars are not controlled. During pregnancy, it could have a preterm delivery or it could have a miscarriage, and for the child as such, if you see, the baby will be a large birth weight baby if the sugars are not controlled. So it's going to have delivery complications, and apart from that, when the child is born, the sugars can be low or high, and it also affects, in the long run, the child can be, this is a risk factor for developing diabetes.
Even after the post-delivery, if the mother is having a gestational diabetic, is there any chance of the mother getting a diabetic in future?
Gestational diabetes is, yes, it is actually like maybe in the long run, because once a person has gestational diabetes, so in the future there is high chances, it is a risk factor. It tells that this lady is going to have diabetes in the future. But it's not that they are going to develop it, okay? It may be delayed, but this is where comes the lifestyle changes. You need to adjust your diet, you need to exercise, you need to maintain an ideal body weight. So then maybe you can postpone it, or maybe if your lifestyle is very healthy, you may not even have it.
What about hypertension and high cholesterol? Does unhealthy lifestyle increase their risk?
Yes, this is also included in the spectrum of lifestyle diseases, because again, hypertension is high blood pressure. And again, if you're obese or your lifestyle is, again, your eating habits are messed up, high salt diet, high oily foods is going to increase hypertension and hyperlipidemia. Hyperlipidemia is basically high cholesterol levels. The kind of food that we are eating right now, it's so processed, it's junk food, it's oily, we are not concerned about it. So it leads to an increase in the cases of hypertension and hyperlipidemia. And put together, it's again going to affect the heart and the brain.
Doctor, can you please tell us about what is metabolic syndrome?
Metabolic syndrome is like a family package. So if you talk about it, we spoke about diabetes, spoke about hypertension, we spoke about high cholesterol. All this together along with the waist circumference. So here comes the important point of abdominal obesity. In women, it should be less than 88 centimeters. Men should be less than 1 or 2 centimeters. Because if there is abdominal obesity, there is high chance for insulin resistance. So along with all this spectrum of diseases, this person is more prone to develop more and more complications.
Apart from unhealthy lifestyle, in what way other habits like smoking, drinking, and substance abuses will affect our health?
Yes, when we talk about lifestyle, we should not be concentrating only on diet and exercise. What we do with ourselves. So nowadays, it's become it's like a fashionable thing to, in colleges and schools, we find kids are smoking and vaping, absolutely unaware that in the long run, it's definitely going to affect their body. Smoking, if you see, we just think it's going to just affect only our lungs. The lungs, yes, there is going to be chronic bronchitis, increase in the number of cancers, and case of emphysema and recurrent infections. But apart from that, this is again a very, very important risk factor for cardiovascular disease and for cerebrovascular disease. That's why we stress that smoking, it has thousands of harmful chemicals. Nicotine is one of them. Even vaping, they say, e-cigar, it's smokeless, it's quite fashionable, but even that, there is some additives in it, and any change in that or even vaping is quite harmful because still research is into that. And I would definitely want to tell everyone to, if they are smoking, whether it is vaping or cigarettes, just you need to quit smoking. That's very important. Alcohol, yes, even alcohol, all this is very important because even alcohol can affect it can cause involvement of the gastrointestinal tract, it can involve the pancreas, it can cause peptic ulcer diseases, it can cause brain damage. So it's very important that these things really need to be cut down for a very healthy lifestyle. That's very important. And we are talking about women, right? So for women, it's very important during pregnancy especially, if you're smoking and you're drinking, it's going to really affect the baby. There are lots of cases with congenital abnormalities. That's because of smoking and alcohol, which can cause, cleft palates, and it can affect the brain. It can cause brain damage. So really you need to cut down, and women especially, if you're smoking or drinking, you should stop it.
Doctor, can you please tell us what are the lifestyle intervention that we need to take to reduce these diseases, that will help to reduce these diseases?
First and foremost is we have to take care of our health. Okay, so the first and foremost thing that we should do is we have to have a very balanced diet. I see many patients coming and telling me I'm on keto diet and different types of diet. But in the long run, our body needs a balanced diet, a balance between carbohydrates, proteins, and fats. Our body needs energy. But what you eat is what you become. So the portion control is very important. Whatever you eat, don't overdo it. Everything in moderation. So I would say there are two important cues. One is the quantity of food that you eat, and one is the quality of food. So when we say quality, it is healthy food. Increase intake of fruits and vegetables. Reduce carb intake. Reduce fatty, sweets, desserts, and oily food. Don't take that. Don't include that much. And even if you go to a buffet, don't try to, take everything on your plate. Because what you eat is what you become. And then we are seeing cases of a lot of weight gain because of our dietary habits. And talking about junk food, yes, try to restrict, especially for our children also. It's become quite common for them to order from outside. So delivery options So they just need to give a call and we get the pizzas and the burgers, French fries. Very unhealthy, very, very unhealthy. It's messing up with their lifestyle. So most important, go and increase your intake of fruits and vegetables and healthy food.
Can you please give an advice on most of the children, even the adults, are having a habit of drinking the carbonated drinks like cola, Pepsi. How will it affect our life?
I think this is one thing which everyone really needs to stop. Colas, any type of colas, whether it is diet soda or just any of these carbonated drinks, any of these bottled drinks. The problem with this is there are so many additives, so many harmful additives. It is very addictive because the moment you have one, you need to, go on with the other. And even now, the condition now is in every household, we have cans of these sodas. The children are so used to it. They're so addicted to it. The moment you say no, they're not going to listen to you. They need it. The problem with this sodas is all these chemicals like phosphoric acid and there are some benzoates. What it does, first and foremost, it dissolves the enamel of your teeth. So there's increase in the cases of dental caries. Dissolves your bones, can affect your kidneys, so you pass urine. And then nowadays we see there is an increase in the children being quite hyperactive. That I would say that they have this increased sugars because each soda, the can of soda that you have, it has 10 to 12 teaspoons of sugar. So the moment you have one can, you're taking 12 teaspoons of sugar when your body is supposed to take the whole day is only 6 teaspoons is the maximum limit. So you're overloading your body with sugars. Your body cannot metabolize it because there's not much insulin to metabolize. All these sugars get deposited. And if you see, the children are quite hyperactive because of the chemicals, because of the additives in the sodas. So it is very important that each of you realize that sodas are not at all healthy. It's absolutely not healthy. If we can make a stop to it, first and foremost, the adults have to put a stop to it. Only then you can tell the child. Because what you don't do, the child is just watching you. You just say, don't drink, he's not going to stop. So you have to put a stop to it. Because in the long run, again, this increases your chances for obesity and you end up with all these diseases, the lifestyle diseases.
Can you please tell us how exercise is important to us for a healthy lifestyle?
See, it's very important because what we eat, right? We're taking in calories. Sometimes we may take extra. What is important? We need to burn these calories. Our body requires to, metabolize everything. Exercise is very, very important. At least now you have all these apps where you say, I walk 10,000 steps and you're happy with it. But do include active aerobic exercise. Could be anything. You don't need to go to the gym only. Even walking, brisk walking, running, jogging, swimming, cycling, Zumba, you name it, anything. It should be at least 150 minutes a week. So if you divide it over 5 days, 30 minutes a day, it's fantastic because it keeps your system working well, your calories are burnt, and you don't tend to put on weight, so you avoid all these diseases.
So that's it, doctor. I think we have covered all the queries regarding the topic lifestyle, disease and intervention. Thank you so much for joining with us. Can you please give a takeaway message to our viewers?
Thank you, Kripa. And the take-home message for the viewers is, keep your life on track. T stands for take your medications if it has been prescribed by your doctor. R stands for reach and maintain an ideal body weight. A stands for activity, exercise. As I already told you, it's 150 minutes a week. C stands for controlling your ABC. A stands for HbA1c, B stands for your blood pressure, C stands for your cholesterol levels, and K stands for kick the habit. Kick all the unhealthy habits like unhealthy lifestyle, unhealthy diet, smoking, alcohol, and substance abuse. Thank you so much. Stay healthy and stay safe.
Thank you, Doctor, once again for answering all our queries. I hope our viewers found this episode very informative and useful. Anything related to internal medicine issue, you can contact Kim's Health Medical Center, Mohorek. And today we have taken the topic lifestyle disease and intervention. And we had Dr. Hajira from Kim's Health Medical Center, Mohorek. Next week, same day, same time, I'll be back with yet another doctor on Kim's Health Doctor Live. Till then, it's Kripa Rajiv signing off. Take care and bye-bye.